Well, my name is Joseph. I'm a nurse at Banner University Medical Center in Tucson, Arizona. I work in the perioperative department. I'm here to talk to you today about nursing fatigue and burnout, which are quite common in the field of nursing. It is a physically demanding job that requires often critical thinking skills and decisions that need to be made on a minute-to-minute or second-to-second basis that can sometimes affect the life or death of a patient. The nursing requires long shifts, sometimes over 12 hours, sometimes upward to 16 or maybe even 20 hours. Now, you wouldn't want your loved one, a family member, or yourself to be under the care of someone who's tired or exhausted from working one of these shifts and hasn't slept in 20, 22 hours and can put your life at risk or a loved one's life at risk. A recent report from 2013 stated that 60.1% of nurses experience one type of overtime, whether it be mandatory, voluntary, or on-call. Among nurse injuries, verbal abuse at 56.6 and bruises or contusions, 49.7 are the two most frequent injuries experienced by nurses. In total, 79.2% of nurses experience one of these injuries during the past month. In regards to patient care and adverse events, medication errors are 44.5% and patient falls at 38.2% are the most frequently reported adverse patient reactions. 61% of nurses perceive that patients on their unit experience one of these events during their hospital stay. My recommendation for a state-mandated policy is based on the guidelines and recommendations of the Association of Perioperative Nursing, AORN, regarding safe staffing practices. This policy regulates nurses to shifts no longer than 12 hours unless there is some sort of critical need for the nurse to stay. Nurses may not work more than 60 hours per week, including scheduled shifts, overtime, on-call, and callback. Furthermore, periods between shifts should be a minimum of 8 hours to allow for sleeping and activities of daily living. My proposed outcomes for this policy will improve staff morale, overall staff satisfaction, a decrease in unintentional self-injury to staff, decrease incident reports, which include but not are limited to patient falls and medication errors, in turn improving overall patient care. In order to evaluate the effectiveness of this state-mandated policy, hospitals will be required to support a report stating the number of self-injuries reported by nursing staff and incidents made hospital-wide annually. This report will be a requirement to submit to the body of accreditation annually. This report will be used to compare against previous years as a means for needs for improvement or areas of concerns pertaining to quality of care provided by an institution. Thank you for your time, and you have a wonderful day.